Hey, welcome back to ETAW. Today we're going to be going over our IFAKs, what we believe that you should be carrying in them, our kind of theory behind IFAKs, and bags as we go. This is going to be part one of our series of medical equipment and kits that you should have in your home, in your vehicle, and on your person. So today we're going to be looking at the IFAK. You notice on the outside of here, I have two chem lights. At night, you need to be able to mark places. I've been in situations where I've been in car accidents where people have been ejected or people are not necessarily right near the car, or the car is 40 yards off the road, and we need to be able to mark those areas. So these chem lights are one really easy, good way to mark that way. You can see here, I carry the ties that are actually on it. That way I can throw it up into a tree, I can swing it around my head, anything to be able to mark where it is. Also, if there is multiple patients, I can sling these around the neck, triage that patient, go on to the next patient, triage this one, triage the next one, throw this around their neck, and then I know those people will be triaged, but then it's also a lot easier for me to find. So I always want to carry a couple chem lights, or brake lights, whatever you want to call them. Up here also I have a Sharpie marker, just great for writing down times on your tourniquets, or anything else you need. If you're writing down interventions or anything that you did, what time you did those interventions, the Sharpie's on the outside. Also that we carry with us, this actually goes on the back side of the pouch when it's connected to my belt. These are trauma shears, just general trauma shears, nothing huge. My favorite brand, I don't have it on this pack, called X shears. X shears are phenomenal. They do just a great job. So when we open the pack up again, in all of my IFAKs, emergency kit, first aid kits, individual first aid kit is what it stands for. I have another. This is one of my biggest life-saving pieces of equipment. Again, the tourniquets have come back into use, and they have saved thousands upon thousands of lives. Need to carry at least one tourniquet with you. Again, I carry two, but carry at least one. When we open up, one of the things that I always like to do is my zippers are always right at the top. I line them up at the top so that I know exactly where they are. Again, if it's dark, I need to get at it. I know exactly where the zippers are. I don't have to search for them. Folds out. So we have a nasal pharyngeal airway, 28 French nasal pharyngeal airway. We have two sets of gloves. When we go onto the big side, we have one Celox gauze. We have one North American Rescue 6-inch trauma dressing. I think I stated this before in one of my videos, but I much prefer 6-inch dressings over 4-inch dressings. Next thing we have in here is hyphen chest seals. Again, there's two of them. One goes in. Usually, sometimes it comes out the other side. Most of the time it comes out the other side. Want to be able to plug both of those. I carry a 1-inch medical tape, four yards of duct tape. We have one compressed crinkle gauze. Now, crinkle gauze is more for wrapping versus actually packing the wound. So the Celox is going to be our main packer, and then this is going to be our main wrap if we need to use a wrap. I have one hand hygiene kit. So what this has in it is two Castle soap towelettes, and then it has two Perel hand sanitizers. We have one cravat, and then we have one rescue blanket. Again, all of this together makes up for what you would need in an immediate situation to stop the bleed, to get things under control to where we can rethink again. Hopefully in today's times, get extra help there. If we don't have extra help coming, that allows us to get more into our trauma bags. Now, one of the things that I recommend is everybody in your mag, everybody that you're working with, carry the same equipment, carry it in relatively the same place. So I know if I need a 6-inch dressing, I need to go over here and pull that out. Again, it makes it a lot easier for nighttime. One of the things that I always carry on my person is a headlamp. It just, again, helps us identify in night. Fortunately, a lot of the accidents, a lot of bad things happen at night, so we want to be able to make sure that we have everything set up for the night. You want to know where your stuff is. You don't want it in extra bags. You want everything out, able to get to relatively easily. Hope you learned from this. Talk to you next time on ETAW.